Presenting this video of meniscus repair with circumferential compression stitches for benefit of our fellows and orthopedic residents. This was a case of 35-year-old male with lateral meniscus tear, complete ACL tear and medial meniscus bucket handle tear and locked meniscus. So, if you can see, there is lateral meniscus complete tear as well as medial meniscus. So, this is the arthroscopic finding in which there is a locked bucket handle tear of medial meniscus. You can see the locked medial meniscus out there in the medial compartment. After the reduction, you can see the edges of reduced meniscus. Once the meniscus is reduced, edges are freshened, and then we move on to lateral compartment, where we can see a large longitudinal bucket handle tear of lateral meniscus as well. So, it is nearly posterior 1/3 of lateral meniscus is involved up to popliteus tendon, up to the popliteus hiatus. So, this was a paper by Justin Salomon in arthroscopic techniques on circumferential compression. If we see traditional all inside repair, you can compress only superior or inferior surface, while compression stitches or circumferential compression is achieved. So, here you can see we are taking bites with knee scorpion, peripheral bite we have taken, one central bite now we are taking, and we create additional port to park these sutures. So, now these sutures are parked. I will take few more bites. This is on the peripheral part. Then I retrieve this suture below the meniscus, and then I use a scorpion, and then we place knots out there. We try to place the knots as peripherally as possible. So, couple of knots there, and then we reassess our construct. So, here we can add one more stitch. So, peripheral suture is taken. Now, we take on the inner fragment. A bite is taken with scorpion, and then the peripheral suture is made as a post and knot is tied. So, this is a complete repair of posterior 1/3 of lateral meniscus by circumferential stitches, and now we move on to the repair of medial meniscus. This is the standard medial meniscus repair using few inside out stitches with fiber wire 2-0 inside out method. We take few on the under surface also. So, these are the stitches on the under surface. Then the posterior most part all inside suture repair is done with the using an implant. So, couple of implants are placed. Here fast fix is placed. So, that completes our medial meniscus repair as well. Thank you.